Yeah.
Drop the roof and let the smoke clear. I got diamonds doing sissy slides in both ears. Dice rolling on the Las Vegas strip tonight. Slip that on and we might just.
Hey everyone, this is T. So I'm back with another video. This video today is specifically showing you guys how my job is, like what I do at work. I wanted to bring you guys with me. So you're gonna watch me do my job, basically. I know a lot of you are aspiring hygienists or assistants or aspiring dentists, and you want to see how the process goes inside of a dental office, like on a day-to-day basis, like what I usually do. So what you're seeing right now is me cleaning up the room after I've seen a patient already, and I'm basically just removing all of the dirty barriers and the instruments, and then I'm gonna get wiped and everything. But first, I spray with Cavicide, which is the bactericidal, insecticidal, stericidal spray, and we use this as a hospital grade base spray that we use, and then we also use wipes as well. So hospital grade wipes to wipe everything in the room after we're done with the patient, and just watch me do what I'm doing. I hope that this video is helpful. I hope this gives you some insight, and I also hope that this helps you decide if you want to do dental hygiene or not, if you want to apply to a school. Please like, comment, and subscribe. So if you want to see more of these videos, and leave all your questions and comments in the comment section, and email me if you have any questions as well. But yeah, so you're just gonna watch me wipe. Your first semester of dental hygiene school, you're basically learning how to wipe the whole time. Majority of the time, you're just learning how to wipe. And in hygiene school, they teach you that you should wipe twice, one time to sterilize and the second time to actually disinfect. And we don't have time to do that in a real dental setting. You only have about an hour with the patient if you have that much time. So we really don't have time to wipe twice. So you're gonna see me like do a quick wipe, which is a bit different from what you do in school. But we do spray to make sure that there's, reduction of aerosols in the air and stuff like that. But yeah, you might see people even and wipe even slower than this. Like they might wipe like heavy, but I just make sure, especially if there was no blood, I'm just getting out all of the little crevices and everything. And we wipe all the way down the cords because the cords do touch the patient and they do touch the floor as well. And we just wipe everything. Even if you haven't touched it, you should wipe it. So yeah, I feel like wiping is my favorite part, to be honest. It's kind of crazy to say that, but I really like wiping because I like cleaning. Like I'm one of those people who love cleaning. But yeah, so after we do that, my day basically consists of me making sure I've looked over my schedule. I know what each patient is coming in for. I communicate with the doctor, the assistants, the front desk, and the rest of the staff, and even the other hygienists to know um, what I need to do for the rest of the day. Like I said, we work very independently, hygienists, so we don't really communicate with the rest of the team unless there's, you know, like everybody knows what they need to be doing. You work very independently. So now you see me, I'm in the sterilization room, the sterilization lab area. There is a clean and a dirty side. Where I'm standing is on the other side of the room. That's the dirty side. Where my phone is sitting, where I'm recording from, is the clean side. What I'm doing is taking all of the dirty things I was using on the patient that can be disposed and throwing it in the trash. And then I'm taking the x-ray rings, which these hold the sensor for us to take x-rays. The different colors mean different things. I can go through that in a different video. But we take that and we put them inside of the ultrasonic, which is that big thing, and I'm going to turn that on. I'm also going to take my set of instruments and I'm going to scrub them with soap and water. We do this just to remove the excess debris off of the instruments so they can be as clean as they can be. They're still dirty. They still have to be sterilized. They still have to be bagged up and put inside of the sterilizer to be steam sterilized in the autoclave. But we still use the soap and water just to get off anything that, like, calculus, saliva, biofilm, all of that off the instruments and get them pretty clean. So I do that. And then I put them into the ultrasonic as well. I know there's a debate between what kind of instruments go inside the ultrasonic and uh, like if you put this and that. That's a whole different video. If you're interested in knowing about that specific stuff, then you can comment and ask me about that. But very basic, real quick video type stuff. I'm just gonna put that in there, let that shake around. We let that be in there for about 5 to 10 minutes. That ultrasonic solution, what it does is it just loosens up the debris that's on the instruments, and it doesn't get them clean. It just sterilizes it, excuse me. It doesn't get them clean. It just gets the debris and blood and saliva and everything loose off of it. And then once that comes out of there, we rinse it off and then we bag them. So I just rinsed off this Cavitron. You should be spraying it sometimes and then just close the bag. It has like a little dotted line. And now this is dirty. So that's where that goes in that basket. And then someone or me will go and put these in the steam autoclave, and then we close the autoclave. I'll show you that in a second. So during this time, I'm just kikiing with my coworkers and everything, talking to them, catching up, So you might see me like laughing. You might see one of my coworkers, Jenny, kind of pass by, say hi, whatever. She's so funny. She's so cool. That's why it's so important to work with people that you really like, because it makes the work environment less repetitive. Because dental hygiene can be so repetitive and so monotonous. It's just the same thing over and over and over. So sometimes, it's just good to have conversations with people that you're cool with, or just even like, shoot the shit, pass time. So yeah, so I just wipe that tray down with the sterilization wipes, uh, sterilized wipes, and then I put it on the clean side and let that dry. And then I am a very cool hygienist. I will help you clean up your room, even if I'm not busy. Like, like I help the doctor and everything. I'm cool. So this is what the dirty side looks like. The dirty side has these mats. These mats are put into the washing machine, and most offices have washing machines. And then these are the autoclaves I was talking about that steam sterilize. You might see these in nail salons and other medical facilities. That little thing in the middle is actually what they use for the hand pieces, to oil the hand pieces. Um, that basket is where all the sterilization stuff needs to go into the autoclave. That's the spray. And then you can see that this is actually what the packs is supposed to look like. So that one on the left was hygiene instruments, and that one on the right was doctor's instruments. So that's what I'm saying. Like, the doctor uses something different than a hygienist. And then this is the hygiene drawer. This is where, in the hygiene room where we're using, we use hygienists use polish. The polish has a bit of fluoride and pumice stone and flavoring in it, so it's like dye and mint flavor most of the time. And then we have prophy angles. These go on the handpiece in order to polish, which is what you hear, like that fast drill sound that the hygienist uses when they do cleanings at the end. And then this is a suction straw syringe part, the suction, and then gauze, 2x2 gauze, and then we also have fluoride gel. Fluoride is recommended. It's not necessary, but it's recommended with the brushes and everything. So this is what the drawer looks like that the hygienist uses. We also have topical gel. That's what that strawberry stuff is. And then this is floss, this floss dispenser. And then we also use these brushes for like ortho, or if someone has very strong stain. So that is what the drawer looks like, and that is what the tray setup is like for x-rays, my instruments, and my Cavitron tip, and my bib chain, and all of that. I actually should have been in that drawer with clean gloves and not just my bare hands, but my hands were clean, just so you know. So also something we do is charting. Hygienists have to know how to chart, how to write notes, how to answer the phone, send fax, send emails. We have to know how to use the computer. So this is someone's chart. This is showing that this person needs 2 crowns, like caps, on the right side. And they need a filling on the upper right side. The U on that tooth means that it is not erupted, like those are wisdom teeth that haven't erupted. And that circle around that lower tooth means that it is a tooth that is being watched, like something's wrong with it. and I have to know how to put those codes in. These are referral sheets for like an endodontist, and this is my sheet where I just wrote all my notes from when I had a exam with the doctor, or just things that I write to myself while I'm talking to the patient and evaluating the patient to know what I need to put in my note and what to do next with the patient, like their blood pressure and all that. I did not show your blood pressure cuff, but I do take blood pressure before we get started on anything. Or if there's any changes to their medical history, I'll write that down on a note or whatever, or I'll put it directly into the electronic note before we get started. So this part is pretty self-explanatory. This is where I'm actually writing my note now. Um, I like to use the auto notes that are in the computer already. Majority of offices are electronic now. You might find an office that's not electronic that uses paper charts, but the electronic notes will have a template where you can just plug in your information. So it will have everything listed, and you just put in the information specifically for that patient, and then you save your note in that chart for that patient. Same thing with the x-rays. The x-rays will most likely be digital at the offices you work at now. Everything's digital, the chart and everything. The only time when we use paper, if we do, it's scanned in, so we just scan it into the chart and everything is kept electronically. So I'm just writing down the notes that the doctor had went over with me. If the patient needed any fillings, anything that the patient had, like their chief complaint, what they addressed. This is something you learn in hygiene school as well. This part is called like SOAP, SOAP. You learn this as like treatment planning, note taking, notation. And this part is very important because this is when you run into where your dental hygiene note is a legal document. Like you have to be very specific with your notes and very detailed. Detail enough that you cover your behind legally, and that you also detail enough that if the patient comes back, that we know what they're doing, what was said, things like that. So that's what I'm listing. But like I said, I hope you're enjoying this video thus far. I'm like getting frustrated because I forgot something and I'm like can't remember what I wrote. What else do I do? Dental hygiene is cool. I do like my job. It has gotten easier now because I have gotten used to it. It takes a lot of practice. I think probably like my fourth or my fifth year, I finally felt comfortable in my field. Like that first, I'm going to be very honest with you, that first like 6 months to 2 years in your career, you're going to be like, as an assistant, as a doctor, as a hygienist, whatever you are, you're going to be like, kind of overwhelmed. It's going to take time for you to get used to it. Depending on what environment you work in, it can be very stressful. You have to find the environment that works with your energy. Like I'm a very cool, calm, collected, but fun and relaxed kind of person. I really don't want to work in a very fast-paced environment like that. Like I can, but I'd rather not. Like I'm getting to the point in my career where I'm kind of lazy. So I don't really want to work in somewhere where I'm seeing like 10 patients a day. If I see 4, 5, 7 patients a day, I'm okay with that, and that's cool with me. But we see patients for a variety of things. I assist the doctor sometimes with their procedures too. It's not required, like I don't have to do that, but if I have nothing to do, I'll stock the room. I will help the assistant with like inventory. I'll help the front desk like call patients to do like recalls and just like keep up with appointments and things like that. I'll keep the room clean. And yes, I'm a travel hygienist, but I function like a regular hygienist. Like you do not have to do any of the things that I just listed, but people remember those things. And I'm just one of those people where I just don't know how to sit down and do nothing. Like I'm either making a TikTok, I'm cleaning up, I'm helping you, I'm stocking the room, like I'm organizing, I'm sharpening instruments. That's something else that we do. So I think by this time now in the video, I've seen like 3 patients already. So, yeah, I'm gonna give you like a tour of the room now. So this is the so this is the instrument tray. Basically, this is the tray that we use that's attached to the chair. That is the air water syringe. The water is on the left, the air is on the right. And this is the handpiece that we use to polish your teeth at the end of your cleaning. And that is where that Profi angle purple thing goes on. This is the chair. I really like these chairs. These chairs are very comfortable as well. That is the radiology x-ray head and tube, and that head extends over to reach over to the patient. That is the lead apron hanging up. And then this part of the chair is where like if this room was used for doctors, this is their high speed, the very loud suction. And then you have the low speed, another air water syringe, and my Cavitron, which is where we use like the water, and then the pedals that we step on. So that pedal, the black one, is for the Cavitron. And then that circle silver one is for the air water, the handpiece to polish, and then that other pedal is to adjust the height and put the chair up, back, side to side. So after that, it's important to know how to use the chair, because if something goes wrong with the chair and you have no one to help you because they're all busy or something's going on, you need to know how to work the chair. Some chairs take distilled water, and you have to fill this bottle up, take the water out, and go get water and put it in there. And then that's an assistant chair, and then a chair for like a patient to put their stuff, or if their family comes to sit down. That is my Cabotron tip, hand sanitizer, all of that. Those are some glasses I got from Amazon just to give loops vibes until I'm ready to buy some loops. My gloves, the sensor, the X-ray sensor, and the intraoral camera over there. And then this is what the setup looks like. This is the computer and everything. And I'm just covering up like not patient information, but like the office I'm at. And that is a patient mirror. And then this is the room. That's the chair I sit in. And this is the room. Like, that's the overhead light. There is a computer screen so we can show the patient their x-rays. And then they can also watch TV. This office has like cable and stuff. And then this is the periodontal probing chart just to show the patient.
Hey, so I know I look kind of crazy, like, but I'm at work. This is how I be looking, just like this. I'm about to go to lunch now. I technically don't have an hour today. I only have a 30, and I have a little gap between another patient in the afternoon. So far, I've seen 3 patients. I have about 6 patients on the schedule today. One canceled, but another one got filled, so I technically still seen what I was supposed to see today. One patient was like a regular exam, prophy, cleaning, periodontal probing. I wrote my notes, he watched me clean up. And then the next one was actually an emergency that they fit in my schedule, but she kind of wanted to see a hygienist because she still wanted a full exam. So I took a full set of x-rays, and I did a piano, and I did a probing on her. I addressed her problem with the doctor. That's when you saw me writing the notes and everything. And then what else did I do? I wrote her notes for her, and then we just went over hygiene and stuff like that. And then my last patient, I didn't show you guys that because it was the same exact thing. I just keep cleaning the room, writing the notes, and bringing them to the front desk. Like, it's really repetitive. It's nothing different. This last patient, I saw her for cleaning. She didn't need to see the doctor for an exam. She just saw the doctor for an exam. She sent him for fillings. She was very nice, and I do get to communicate with the patients and kind of build a rapport with them. Some of them, even though I've been a temp and a travel, I've come to this office several times, so some of them I actually seen again. And it's just nice to see them and just talk to them and just catch up with them, some of them. And yeah, so I'm about to go on my 30-minute. I'm gonna eat my lunch, and I just want salad, nothing crazy. and some snacks and stuff. And then I have to come back at 12 o'clock. Right now it's 11:30. I have to come back at 12 o'clock. And then I have a break at 1 to 1:30. My next patient needs x-rays, a cleaning, an exam, and probing. So that's just how my day goes. My next patient after that, my 12 o'clock needs what I just said. And then my 1:30 is a new patient, so their actual comprehensive exam, meaning they do everything. They do exam, full exam, x-rays, and we determine what type of cleaning they need. And then my last patient is a recall with x-rays, like prophy exam, x-rays, all of that. So yeah, and then there's a block at 4 o'clock because I'm not here till 5 today. I'm here till 4. And then yeah, so that's how it goes. So this is the room. This is how it goes. And I will see y'all in a second.
Feel that